Hello, dog lovers, and welcome to February. It's Dental Health Month here at Discover Dogs. Whether you want to address it or not, everyone needs a dental health strategy for their dog. So we're here to help direct you a little bit today and give you some ideas for optimal dental health for your dog. Stats say 80% of dogs by age 3 will have dental disease. So what does that mean? That means we better figure this out. It's going to cost us more money long term to not address this than it is to sort of get a handle on it when your dog is young. If you rescued a dog recently, no time like a present to get a handle on dental health as well. The most effective way to clean your dog's teeth is through chewing. We prefer natural chews at Discover Dogs, so we want different animal parts, sweet potato chunks, or yak milk chews, even a little bit of wood works. You want to be giving your dog chews that last 3 to 5 minutes, and we want to be doing that about 3 to 5 times per week. So, as you're getting a start on this, come in and chat with us. We need to find treats that you can afford, that your dog enjoys, and that we can give to your dog on a regular basis and don't gross you out, so we can get a handle on this dental health plan. So giving your dogs regular chews is a great idea and a great way of managing their dental health needs. But today we're going to talk about brushing your dog's teeth as another way of contributing to positive dental health. So as you can see, there's a few different selections for toothpaste and toothbrushes here. We have regular toothpaste that comes with a toothbrush. We have the Bristly, which is an enzymatic toothpaste that you can squirt onto toys, or you can use as a toothbrush as well. When we are brushing our dog's teeth, the key is to play the long game. We are not looking to brush your dog's teeth entirely today. We're hoping to develop a positive dental health strategy for the life of your dog. What that means is that on the first day, don't focus on taking a toothbrush and jamming it into your dog's mouth and getting all of their teeth done. Instead, let's make them have a positive association with toothpaste and us reaching towards their mouth. So at the very beginning, take a little bit of toothpaste, smear it on your finger, and hold it out towards the dog. The dog will come in and lick it off, let them walk away, think about it again, and give them a second shot. When we're doing this correctly and building a positive association with toothpaste, when we hold the toothpaste up, the dog should be moving towards it because they're excited. Once they've done that, we're going to squirt some toothpaste on our finger. As the dog moves towards us, we're going to start to move it into their mouth and see if we can brush it on their teeth. Over time, we might evolve to using a little finger brush or an actual toothbrush, increasing the duration and intensity that we're brushing our dog's teeth as they feel more and more comfortable.
You've been brushing, you've been giving your dog chews, and their breath still stinks. So you might be wondering, what else can I do? And so this week we're going to talk about the relationship between gut health and dental health. So one of the main reasons we think about probiotics when we're starting to look at dental health is because a lot of those stinky things that we are smelling or inflammation in the mouth are caused by bad bacteria. A probiotic that is designed for your dog is going to come in with dog-friendly, good probiotics. Those are probiotics that are meant to live in the ecosystem that exists inside your dog's body. So if we can increase the numbers of those good bacteria, you'll be better equipped to fight bad bacteria. The other reason we look at probiotics for helping with dental health is because they are going to help regulate the pH in your dog's mouth and in their gut. So a dog that's fed a processed diet will have a higher pH gut. That means that it is less acidic and so less equipped to fight off bacteria and to break down food. Bad bacteria will colonize and kind of thrive in that environment. So the ideal pH for a dog's gut is between 1.5 and 2.5. And when you're bringing in a probiotic that's designed for your dog, which is why we really like these probiotics over something for humans, they're going to help regulate that pH and lower it so that your dog's body is not as hospitable to a bad bacteria, and the good bacteria, which was meant to exist in that body, will do fine in that lower acidic environment. So if you've been offering your dog lots of chews and you've been brushing and you're still not making any progress, come in and chat with us about some probiotics and we will find one that works for you and your dog.
Hi! So today we're going to do a dental exam on Dolly, and fortunately we don't have to do any desensitizing. She's quite comfortable with us touching her mouth. But when I'm doing a dental exam, I actually check out the eyes first. The eyes are a big indicator of what's going on in the roots in the teeth. And so if I do see a lot of clear discharge, it's very likely that something else is going on under the roots. So the first thing is Dolly has very clear eyes, clean eyes, and likely does not have any issues. And we open up here, and the first thing we're always looking at is the big giant canine. The root on this puppy is very long, goes all the way up to about here. So we want to make sure we keep it clean. As you can see, Dolly has a couple red flags. One is a pretty red gum line. Second, some graying tartar. So tartar takes about 3 days to turn into, to calcify into tartar. And in order to actually gray and get that sort of dead color there, you actually have to have had some substantial amount of bacteria. Another red flag here, we've got a little bit of a growth. And going back to the molars where we have trouble looking at, but super important, holds a lot of the bacteria and tartar. And you can see that Dolly's actually a really great chewer. So she doesn't have any tartar on her back molars, but just on her canine. And her canine's actually the hardest to keep clean and yet the most expensive to remove. So we like to work on that. Other side shows the same thing. She chews really well with her back molars. Gum line looks really healthy. And again, most of the inflammation, take a break, most of the inflammation is just on the canine. So we'll look at having that removed non-anesthetically because there doesn't seem to be anything concerning in terms of abscessing. Good girl. Fortunately, the non-anesthetic cleaning company will go in and look, and if they see something concerning, only at that point will they send you to your vet. We also use a company that does both scaling and polishing. Really important that you polish up anything that you've been working off so that no new bacteria can latch on. So for Gentle Dental, we find not only are they really great with them behaviorally, but they won't charge the client if they're not able to clean it. There's just a better trained eye in the mouth, and they can send them to the vet for the better treatment if they need it. But generally, we're just making sure that if they are a candidate, that nothing's really wiggly, nothing's extremely swollen, potential abscess, and the dog maybe behaviorally would do better under anesthetic.